Have you ever had a pain in the ass? No, literally pain in your ass that may go down your leg due to your sciatic nerve. We previously talked about sciatica that originates from the back, known as radicular pain, but you can also get that pain due to issues at the glute, whether from compression or irritation. And we are going through the best exercises you can do to help this in this video. Hi, my name's Rob from AMR Physio, and this has been known as Piriformis Syndrome, with the piriformis a deep muscle in the buttock, which the sciatic nerve travels near or sometimes through in certain people. However, this more recently has been known as deep gluteal syndrome, as there's a ton of muscles, not just the piriformis, that may be contributing. So, no reason why the piriformis should be getting all the slack for it. Regardless, it won't necessarily be changing the exercises, as a lot will hit several of these deeper glute muscles. So let's look at the best exercises for this. We want to be hitting the glute muscles with loading and stretching, and also focusing on the sciatic nerve. Let's start with number 1, the Pigeon Stretch. This is a great glute stretch if it's any tightness causing issues that's affecting the nerve. A couple of variations for this. The first you can do in seated. Put your ankle on your knee, so your knee is bent to 90, then sitting upright, push your knee down to work on increasing that stretch. To make this harder and to deepen it, then move on to a raised surface with the leg bent, drop the other knee towards the floor, then slowly lower your chest down, trying to get your chest towards the knee. It doesn't matter if you can't get fully down, but just as close as you can. If any of these increase leg pain though, stop them or don't go as deep into the stretch, as it's more likely it will be irritating the nerve rather than helping. Number 2 is a glute stretch. So again, a couple of variations. The first in seated, again, ankle on the knee, but this time bringing the knee the other way up towards the chest, as though hugging it in towards you. Making sure you're sitting upright with your chest up to get the most out of this. The other option is sitting on the floor, bringing the foot across the other side. Again, bring the knee towards the chest with the chest up, and you can pull on the foot to help deepen this. Hold these stretches for around 30 seconds, but making sure no worsening to any leg pain during or afterwards. Number 3 is a loaded external rotation. There's 3 ways to do this: isometrically, inside lying, and with a cable. So for the isometric, sit sideways next to a wall, and with the leg bent, push the foot into the wall. You can do this holding a few seconds and releasing on and off, building for reps, or holding for time around 40 to 60 seconds. If doing it in side lying, then lift the leg off the bottom one with the knee bent, then lower the knee, allowing the ankle to lift up, and then reverse. So the knee goes up and the ankle drops down, working on building up reps and ensuring no aggravations. A really nice way to do this is with a cable. So laying on your front, have the cable attached to your ankle and let the ankle cross over and then bring it back. You want to do this with a weight you can do around 8 to 12 reps with. Number 4 is a single leg RDL or single leg Romanian Deadlift. This would also add a slight stretch to the nerve. So on one leg, keep the leg position relatively fixed and hinge at the hip, keeping the back straight. Lower the body down and lift back up, squeezing the glute as you raise back up. Try doing this without putting the other foot down as you return. And then repeat this for reps, also around that 8 to 12 mark. If this is too hard, do less reps and work on building up. If this is too easy, you can do it with some weights, holding in both hands, or to add further challenge to other glute muscles, then hold into the opposite hand as you lower down. Number 5 is a nerve glider. This is an exercise to stretch the sciatic nerve, which you can do in seated or laying. In seated, lift the foot off the floor and then bring the toes up, and then pulse the ankle backwards and forwards. You don't want to hold this, but glide it on and off. In laying, flex the hip to 90, hold the back of the leg, and then raise the foot up and down. Do whichever gives you the nicest stretch, again ensuring it's not aggravating anything. Sciatica can also originate due to issues in the lower back. Normally, if it's down to the deep gluteal syndrome that we've discussed in this video, you'll normally have the worst pain in the glute, and a lot of time have no back pain associated with it. However, if you're getting this glute and leg pain alongside a lot of lower back pain, it may be the lumbar spine is the cause of your symptoms. If you feel that's more the case for you, then check out this video here, where we cover exercises more focused for when it's affected by the lumbar spine, and also discuss some important symptoms you need to watch out for when that's the case, which would need immediate medical attention.